Hello, my name is Enia Fernandez. Today I will be talking about a case study of the hand. Patient information: male, 19 years old, with the right hand swollen and knuckle depressed. Trauma signs and symptoms are pain and swelling located at the metacarpals. The procedure performed on the patient was radiography of the hand of a 3 views, which were PA, oblique, and lateral views were obtained. A 19 years old with no history of previous medical history. The first step was to introduce myself to the patient. Then I proceeded to ask the patient's name and date of birth. Also, I asked questions on medical history, previous surgeries, or trauma. The patient was shielded during the entire procedure, and the shield was placed on the patient's lap. The first X-ray was a PA hand. The patient was seated with the hand at the top of the table, hand fully open and digits separate. The central ray was perpendicular and digits separated. The central ray was perpendicular to IR and centered to third MCP. The technical factors used were 60 kVps, 3 MAs, SID 40 inches, and 10 by 12 cassettes. The second X-ray was an oblique hand. The patient was seated with the hand on top of the table. Hand and wrist were rotated 45 degrees laterally. I had to make sure that the fingers were separated and parallel to IR. The central ray is perpendicular and centered to the third MCP. The technical factors used were 60 kVp, 3 MAS, SID 40 inches, and 10 by 12 cassettes. The third X-ray was a fan lateral hand. The patient was seated with the hand at the top of the table, fingers separated, hand in true lateral, and thumb side up. The center ray is perpendicular to second MCP. The technical factors used were 60 kVp, 3 MAS, SID at 40 inches, and 10 by 12 cassettes. The oblique image of the hand shows the MCP's oblique with a curvature. That way you know it's diagnostic. You can see the fracture and the distal ends of the ulna and radius. Here we have the fractures, and here's the end of the ulna and the radius. For the lateral view, all metacarpals are superimposed except for the fifth metacarpal, which has the fracture right over there. Results interpretation: acute midshaft on fourth and fifth metacarpal fractures with relative anatomic alignment of the fractured components. There is a peritoneal reaction and corticoidal thickening involving the midshaft of the fifth metacarpal, possibly due to an old-healed fracture deformity with a superimposed acute fracture. Acute non-displaced fracture of the fourth metacarpal midshaft. Acute on chronic fracture through the midshaft of the fifth metacarpal with mild palmar angulation of the distal fracture component. Non-displaced fracture is when the bone breaks but maintains its proper position and alignment. Treatment can be a splint or cast. Displaced bones breaks into two or more pieces and moves out of alignment. Treatment used is surgery, a process called reduction. Open reduction, internal fixation, which means they put some kind of implant inside of the fracture. External fixation is when implants are on the external part of the fracture from the outside of the skin. A buttress fracture is when you break a bone at the base of the finger, known as the metacarpal. Right over here, that's the base of the bone. In conclusion, such fractures are usually treated with a splint, brace, or cast. This immobilizes the injured bone, promotes healing, and reduces pain and swelling. The patient treatment was a splint for about 6 to 8 weeks. depending on how the bone is healing. The radiologist orders another X-ray after 2 weeks to see if the fracture is healing properly.